Gum disease, or periodontal disease, is an infection affecting the tissues supporting the teeth. The primary cause of gum disease is inadequate oral hygiene practices. Poor oral hygiene results in the accumulation of plaque on the teeth. Plaque, if not removed, hardens into tartar, which is difficult to clean. The buildup of plaque and tartar leads to infection and inflammation of the gums. The initial stage of gum disease is gingivitis. Gingivitis is characterized by inflammation and bleeding of the gums. If gingivitis is left untreated, it can progress to periodontitis. In periodontitis, the inner layer of the gum and bone pull away from the teeth. This creates pockets that become infected, further damaging the supporting structures. Dementia is a broad term describing a significant decline in mental function. This decline is severe enough to disrupt daily living activities. Alzheimer's disease represents the most prevalent form of dementia. Dementia is not a specific disease, but rather a group of symptoms affecting cognitive skills. Besides Alzheimer's disease, there exist several other distinct types of dementia. Vascular dementia results from reduced blood flow to the brain, causing cognitive impairment. Lewy body dementia is characterized by abnormal protein deposits in the brain. Frontotemporal dementia involves degeneration of the frontal and temporal lobes of the brain. Gum disease initiates chronic inflammation within the oral cavity. This inflammatory response leads to the release of inflammatory molecules. These molecules then enter the bloodstream. Circulating in the blood, these molecules can travel to the brain. Inflammatory molecules can enter the brain. These molecules contribute to neuroinflammation within the brain. Neuroinflammation is associated with neuronal damage. Neuronal damage can lead to cognitive decline. Cognitive decline is a characteristic symptom observed in dementia. Specific oral bacteria, like Porphyromonas gingivalis, can be introduced into the bloodstream. This occurs primarily as a consequence of gum disease and compromised oral health. Once in the bloodstream, these bacteria have the potential to cross the blood-brain barrier. This translocation allows bacteria to enter the central nervous system. Recent research has identified the presence of P. gingivalis in the brains of Alzheimer's patients. P. gingivalis is a type of bacteria known to produce toxic byproducts. The presence of these bacteria and their toxins suggests a potential link to Alzheimer's disease. This indicates a possible role of bacterial infection in the development of the disease. Further research is needed to fully understand the nature and extent of this relationship. Epidemiological studies investigate the distribution and determinants of health-related states or events in specified populations. These studies have revealed a correlation between oral health and the risk of developing dementia. Poor oral health, particularly gum disease, is associated with an increased risk. Gum disease involves chronic inflammation and infection of the gums and surrounding tissues. The observed correlation suggests a potential link between oral health and cognitive function. Further research is needed to fully understand the underlying mechanisms of this relationship. Research indicates a potential link between gum disease and cognitive decline. Individuals with gum disease may experience a more rapid cognitive decline. This decline is observed when compared to individuals with healthy gums. Further research is needed to fully understand the mechanisms behind this association. Recent research suggests a potential correlation between gum disease and Alzheimer's disease. Individuals with gum disease may exhibit elevated levels of Alzheimer's-related biomarkers. These biomarkers are detected in the cerebrospinal fluid, indicating a possible systemic connection. This finding implies that oral health could influence the progression or development of Alzheimer's. The blood-brain barrier, BBB, serves as a critical protective mechanism for the brain. It selectively restricts the passage of substances from the bloodstream into the brain tissue. This barrier prevents harmful elements, such as toxins and pathogens, from entering the brain. However, the integrity of the BBB can be compromised under certain conditions. Inflammation within the body can weaken the barrier's protective function. Certain bacterial infections are also capable of disrupting the blood-brain barrier. The blood-brain barrier, BBB, normally protects brain tissue from harmful substances. A compromised BBB allows easier passage of bacteria and inflammatory molecules into the brain. Gum disease can be a source of bacteria and inflammatory molecules. Therefore, gum disease may contribute to brain inflammation via a weakened BBB. Alzheimer's disease is marked by the buildup of amyloid plaques in the brain. Amyloid plaques are abnormal protein clumps that disrupt normal brain function. These plaques interfere with neuronal communication and contribute to cognitive decline. Research indicates a potential link between gum disease and increased plaque formation. Inflammation from gum disease may exacerbate the accumulation of amyloid plaques. Tau tangles are a key characteristic of Alzheimer's disease. Chronic inflammation can potentially influence the formation of tau tangles. Inflammation may promote the development of these tangles within the brain. The spread of tau tangles could also be exacerbated by inflammatory processes. Therefore, inflammation is a factor impacting the progression of Alzheimer's. Reducing inflammation may potentially slow the formation and spread of tau tangles. Maintaining good oral hygiene is essential for overall health. Brushing teeth twice daily is a fundamental practice. Daily flossing removes plaque and debris from between teeth. Flossing reaches areas a toothbrush cannot access. Using an antiseptic mouthwash helps kill bacteria. These measures collectively promote healthy gums and teeth. Regular dental checkups are crucial for maintaining oral health. These checkups facilitate the early detection of gum disease. Dentists perform professional cleaning to remove plaque and tartar. Plaque and tartar removal helps prevent gum disease progression. Dentists offer personalized oral hygiene advice during checkups. An anti-inflammatory diet focuses on consuming foods that help reduce inflammation in the body. This diet is rich in fruits and vegetables, which are high in antioxidants and beneficial compounds. It also emphasizes omega-3 fatty acids, known for their anti-inflammatory properties. By reducing overall inflammation, this diet may lower the risk of related health issues. Managing existing health conditions is crucial for overall well-being. Conditions like diabetes can worsen gum disease. Cardiovascular disease can also exacerbate gum disease. Both diabetes and cardiovascular disease are linked to an increased risk of dementia. Therefore, managing these conditions can help mitigate the risk of both gum disease and dementia. Proactive management of these health issues supports better long-term health outcomes. For concerns regarding gum disease, consulting a dentist is recommended. A dentist can provide evaluation and management of gum-related issues. If there are concerns about dementia, consulting a primary care physician is advised. A primary care physician can offer appropriate evaluation and management strategies for dementia. Smoking is a major risk factor that significantly increases the likelihood of developing gum disease. Smoking can exacerbate the severity and progression of existing gum disease. Cessation of smoking is beneficial for improving overall oral health. Quitting smoking can potentially lower the risk of complications associated with gum disease. Chronic stress can significantly impair the body's immune system. Elevated stress levels are associated with increased inflammation throughout the body. This combination of weakened immunity and heightened inflammation can exacerbate gum disease. Implementing stress-reducing techniques may help lessen the negative effects of stress on gum health. Ongoing research investigates the potential link between gum disease and dementia. The research aims to understand the specific mechanisms by which gum disease might contribute to dementia. Scientists are working to identify potential targets for preventing dementia related to gum disease. The ultimate goal is to develop effective treatments for dementia linked to gum disease. Emerging evidence indicates a possible connection between gum disease and the onset of dementia. This connection underscores the significance of maintaining good oral hygiene practices. Further research is necessary to fully understand the nature and extent of this relationship. However, current findings suggest that oral health may impact cognitive function. Therefore, proactive dental care is important for overall well-being, potentially including brain health. Prioritizing oral health involves consistent dental care. Good oral hygiene practices are also essential. These practices may reduce the risk of dementia. Maintaining cognitive function can be supported through oral health.